This is a recording of the Special Educational Needs Policy, that's to say the SEN policy of Cullompton Community College in November 2015. There are some terms to talk about that get referred to. Firstly, SEN is Special Educational Needs. SEN-CO is Special Educational Needs Coordinator. Waves of intervention relate to a three-tiered model of support that SEN students receive. Wave 1 is inclusive quality first teaching for all. Wave 2 is additional in-class interventions. And Wave 3 is highly personalised interventions. LA means local authority, which is Devon County Council. EHC, Education, Health and Care Plan. This document replaces a child's statement, which is what they used to be called. It's a collaborative document between school, health and social care. If your child has a statement already, it will be reviewed and potentially changed into a statement within 3 years. SEN graduated response is a term used to describe the cycle of identification, support and evaluation put in place for SEN students. Graduated response, that is. So, this is the mission statement. At Cullompton Community College, we're committed to offering an inclusive curriculum to ensure the best possible progress for all of our pupils, whatever their needs or abilities. Not all pupils with disabilities have special educational needs, and not all pupils with special educational needs meet the definition of disability, but this policy covers all of those pupils. At Cullompton Community College, the emphasis is on a whole school approach. All staff accept responsibility for providing all children with realistic learning goals in a broad-based, appropriate curriculum. We believe in nurturing and developing the educational, social, emotional, cultural and spiritual aspects by curriculum design and teaching approaches. The National Curriculum Council stated that participation in the national curriculum by pupils with special educational needs is most likely to be achieved by encouraging good practice for all pupils, and that the majority of pupils with learning difficulties simply require work to be suitably presented and differentiated to match their needs. We therefore intend 1. To have regard to the Code of Practice on the identification and assessment of special educational needs. 2. To follow the guidelines laid down by Devon Education Authority. 3. To work in partnership with the child, parent, carers, all staff, governors and outside agencies. 4. That class teachers will use a range of differentiation to provide effective learning opportunities for all pupils. 5. Where a child is identified as not making adequate progress, provision that is additional to or different from that provided as part of the school's Wave 1 support will be given. Depending on pupil progress, students will receive an increased level of support based on the SEN graduated response. 6. To recognise the importance of early identification through a range of assessment methods. 7. Where a child is identified as having special educational needs, a key pupil profile will be drawn up tailored to each individual child's needs. Realistic targets will be set and the plans will be reviewed and evaluated regularly and involve the child, parent, teacher and all support services. 7. Enhance self-esteem by setting appropriate targets and high aspirations. 8. To use a variety of complementary approaches to support the class teacher and child differentiation. 1-to-1, group, whole class, within the class or withdrawal where appropriate. To include the child within the class wherever and whenever practicable. Endeavour to use all resources appropriately and efficiently. And finally, make full use of all the support agencies that have been made available through the local authority. Code of Practice. The Code of Practice offers guidance designed to help schools make provision for pupils with special educational needs following identification and assessment of their special educational needs. The following minutes, set out the model of assessment and provision that Cullompton Community College will provide in line with the new Code of Practice. Areas of need. Children will have needs and requirements which may fall into at least one of 4 areas. Many children will have interrelated needs. The 4 areas of need are communication and interaction, cognition and learning, emotional, social and mental development, sensory and/or physical needs. Identification and assessment. The law says that a child has special educational needs if he or she has a child or young person has special educational needs if they have a learning difficulty or disability which calls for special educational provision to be made for them. A child of compulsory school age or a young person has a learning difficulty or disability if they either A, have significantly greater difficulty in learning than the majority of others at the same age, or B, have a disability which prevents or hinders them from making use of educational facilities of a kind generally provided for others of the same age in mainstream schools or mainstream post-16 institutions. A child under compulsory school age has special educational needs if they fall within the definition at A or B above, or would do so if special educational provision was not made for them. And that comes from Clause 20 of the Children and Families Bill. This is a broad definition covering children and young people from 0 to 25 years of age. Where a child or young person has a disability or health condition which requires special educational provision to be made, they will be covered by the SEN definition. Post-16 institutions often use the term learning difficulties. The term SEN is used in this code across the 0 to 25 age range, but it has the same meaning. Whether or not a child has SEN will therefore depend both on the individual and on local circumstances. It may not be entirely consistent with the law for a child to be said to have special educational needs in one school but not in another. And that comes from a document from the DFEE, October 1977, called Excellence for All Children. Therefore, the importance of early identification, assessment and provision for any child who may have special educational needs cannot be overemphasised. The earlier that action is taken, the more responsive the child is likely to be, and the more readily can intervention be made without undue disruption to the organisation of the school, including the delivery of the curriculum for that particular child. If a difficulty proves transient, the child will subsequently be able to learn and progress normally. If the child's difficulties prove less responsive to provision made by the school, then an early start can be made in considering the additional provision that may be needed to support the child's progress. Any of the following list may trigger a concern, and the child and parent or carer are involved throughout. Parents and carers, child, class teacher assessments, any of the support services mentioned later, records transferred from another school, baseline assessments, SAT tests and results, in-house testing and assessment, special needs register and pupil tracking. In identifying children who may have special educational needs, we can measure children's progress by referring to 5 things. Their performance, monitored by the teacher as part of ongoing observation and assessment. Their outcomes from baseline assessment results. Their performance against the level descriptions within the national curriculum at the end of a key stage. Standardised screening or assessment tools. Assessments conducted by the local authority or outside agencies. School model of assessment and provision. Where progress is not adequate, it will be necessary to take some additional or different actions to enable the pupil to learn more effectively. Whatever the level of pupils' difficulties, the key test of how far their learning needs are being met is whether they're making adequate progress. Adequate progress can be defined in a number of ways, and here are 6. It closes the attainment gap between the child and their peers. It's similar to that of peers starting from the same attainment baseline, but less than the majority of peers. It matches or betters the child's previous rate of progress. It ensures full access to the curriculum. Demonstrates an improvement in self-help, social or personal skills. Demonstrates improvement in the child's behaviour. If a child's progress is inadequate, or they have an identified special educational need, the class teacher will provide interventions that are additional to or different from those provided as part of the usual differentiated curriculum offer and strategies. This is known as Wave 2 SEN support. There's now an illustration of a triangle or a pyramid with the 3 different waves. Wave 1 is inclusive, quality, first teaching for all. Wave 2 is additional interventions to enable children to work at age-related expectations or above. And Wave 3 is highly personalised additional interventions. The triggers for intervention could be the teachers or others concerned, underpinned by Wave 1 and Wave 2 evidence about a child who, despite receiving differentiated learning opportunities, performs at least 1 chronological year below age-related expectations, or makes little or no progress when teaching approaches are targeted particularly in a child's identified areas of weakness, presents persistent emotional or behavioural difficulties which are not ameliorated by the positive behaviour management techniques usually employed in the school, has sensory or physical problems and continues to make little or no progress despite the provision of specialist equipment. And finally, has communication and or interaction difficulties and continues to make little or no progress despite the provision of a differentiated curriculum. Students are assessed on entry, on their reading, spelling, quantitative and verbal reasoning skills. This is alongside data from previous schools and is used as an initial indicator of a need for support. Students are monitored in class and, if needed, are provided with Wave 2 support. If this proves to be unsuccessful, they are allocated Wave 3 support, at which point outside agencies will be involved. Wave 3 support is reviewed on a termly basis. Teachers, the Director of Additional Needs and teaching assistants are involved in the decision-making process. Parents are informed of the decision-making progress through 6 weekly effort and progress grade reporting on a termly basis. Wave 3 intervention would mean that student is deemed to be a SEN support student. They will be placed on the SEN Special Educational Needs Register, and then this will be reviewed upon completion of Wave 3 interventions. All the above is a graduated response of action and intervention when a child is identified as having special educational needs, but must not be regarded as steps on the way to an education health care plan, as some children will require less rather than more help if the interventions work successfully. The interventions are a means of matching special educational provision to the child's needs and are therefore part of the continuous and systematic cycle of planning, action and review within our school to enable all children to learn and progress. Advice and support may be requested from the Educational Psychology Service and a consultation request will be made. Following consultation, advice would be taken as to future and further action if the child meets the necessary criteria, or it may be deemed appropriate to request a statutory assessment. We're now going to talk about educational health care plans in some detail. A child will be brought to the local education authority's attention as possibly requiring an assessment through either a request for an assessment by the school, a request for an assessment by the parent, or a referral by another agency, for example a health authority or social services. At Cullompton Community College, if, after we've taken action to meet the learning difficulties of a child, the child's needs remain so substantial that they cannot be met effectively within the resources normally available to the school or setting, then we would make a request to the local education authority for an assessment. When a child is brought to the attention of the local educational authority by a request for an educational health care plan, the LEA must decide within 6 weeks whether to carry out such an assessment. In considering whether an educational health care plan is necessary, the LEA will pay particular attention to the following: evidence that the school has responded appropriately to the requirements of the national curriculum, evidence provided by the child's school, parents and other professionals where they have been involved with the child as to the nature, extent and cause of the child's learning difficulties, evidence of action already taken by the child's school to meet and overcome these difficulties, evidence of the rate and style of the child's progress, evidence that where some progress has been made, it has only been as the result of much additional effort and instruction at a sustained level, not usually commensurate with provision through schools. When an education health care plan is made by teachers, When an education health care plan is made, teachers, social care and healthcare professionals will monitor and informally review progress during the course of the year using both the normal curriculum and pastoral monitoring arrangements for all pupils. All education health care plans must be reviewed at least annually, but if a child's special educational needs change, a review is held as soon as possible to ensure that the provision specified in the statement is still appropriate. Pupil passports. A pupil passport should be used to plan the interventions for individual pupils made through Wave 3 and for pupils with educational healthcare plans. It is the structured planning documentation of the differentiated steps and teaching requirements needed to help the student achieve identified targets. A pupil passport should focus on up to 3 or 4 key individual targets and should include information about the following: the short-term targets set for or by the pupil, the teaching strategies to be used, the provision to be put in place, when the plan is to be reviewed, success and or exit criteria, and outcomes. And these should be reviewed 3 times a year. Special educational needs information packs. When pupils have common targets and hence common strategies, a SEN information pack can be drawn up rather than producing passports for each child. There's now a diagram which explains the flow of the college's graduated approach to special educational needs support. Firstly, assessment, drawn on information from point 1 and views of child, parents, external services, and assessed against SEN criteria, which leads to a plan which teachers, SEN co-parent and child agree the interventions and support the expected outcomes. This is recorded on the school system and all staff are informed. This then leads to 3, doing. The plan's implemented and the class teacher remains responsible for working with the child and assessing the impact of the plan. Step 4 is impact, and assessment along with views of child and parent are used to review the overall impact of support. The plan is then revised based on outcomes. That can lead to 2 options. Positive progress means that no more SEN support is required, when no progress means the child goes through another cycle. Medical information. The school database is updated as and when information comes into school. Any major changes are passed on to the teacher within 24 hours. Updated class medical information is passed on to the teacher every term or sooner and kept in the class SEN file. However, a medical diagnosis or a disability does not necessarily imply special educational needs. It's the child's educational needs, rather than a medical diagnosis, that must be considered. However, medical conditions may have a significant impact on a child's experiences and the way they function in school, and if not properly managed, could hinder their access to education. Therefore, consultation and open discussion between the child's parents, the school doctor or the child's GP, and any specialist services providing treatment for the child will be essential to ensure that the child makes maximum progress. This is now about the role of the supporting team, which includes the Director of Additional Needs, one Deputy SENCO, one Teaching Assistant, and one EAL Teaching Assistant. The EAL Teaching Assistant, I'm not sure what that is. You need to refer back to the school for an explanation of that. The support team can also include specialist support teachers brought in from the County Council as and when required. The agreed role of the special needs team is to support the work of class teachers by offering specific and general support to children who are experiencing learning difficulties in either the long or the short term. The SEN nominated governor meets regularly with the Director of Additional Needs to discuss SEN issues. The team will have regard to the code of practice. We will work closely with parents, meeting as and when necessary. We will coordinate the writing of pupil passports and all contributions of those involved. We'll regularly test and set new targets, long and short term, where appropriate, and work with the named children within the class, a group or one-to-one as appropriate. We will plan reviews at least 3 times a year with the parents, child and class teacher. The objectives are to help children to cope with broad-based curriculum and to make progress through the national curriculum by A. Testing, assessing and reviewing the needs of the individual child at least twice a year. B. Setting achievable targets. C. Working in partnership with child, parents, staff and any relevant outside agency. D. Giving access to appropriate resources and encouraging independent use. E. Giving support in the classroom with a variety of tasks where appropriate. F. Providing additional encouragement and praise to promote self-esteem, motivation and concentration. What is the role of the Director of Additional Needs? Here are the points that summarise the role. Overseeing the day-to-day operation of the school's SEN policy. Coordinating provision for children with special educational needs. Liaising with and advising teachers. Managing teaching assistants. Overseeing the records of all children with special educational needs. Liaising with parents of children with special educational needs. Contributing to the in-service training of staff. Liaising with external agencies, including the local educational authorities' support and educational psychology services, health and social services and voluntary bodies. Attend appropriate training to support the role, to disseminate to staff and to use the school development plan to implement new developments. To work closely with the nominated governor for special educational needs. Who has roles and responsibilities? The governing body has important statutory duties towards pupils with special educational needs, as outlined below. The SEN register. The school maintains a SEN register which contains details of all children identified as having special needs. This is confidential. The register is continually being revised and updated. Access and integration. Our aim is for all children to have access to a broad and balanced curriculum, meeting their educational, emotional, social and spiritual needs. All will have access to all national curriculum subjects as at the appropriate stage and programme of study. All children are encouraged to be involved in the wider aspects of school life where the individual can boost self-esteem. And admission arrangements. Following local authority and our agreed admission and equal opportunities policies, a child will be offered a place at Cullompton Community College if it is available. It's important when registering a child that the parent or carer fills in the information sheet, medical information honestly, and informs the school of any previously identified special needs. Transition. The school will liaise with Careers Southwest and other agencies to arrange transition plans for students with statements, EHCPs and other pupils with special educational needs who may benefit from transition planning in Year 9 and will ensure that these transition plans are reviewed annually as part of this annual review process. When pupils move to another school, their records will be transferred to the next school within 15 days of the pupil ceasing to be registered. as is required under the Education Regulations Pupil Information 2000. Support sources. We do not have any special unit attached to our school. However, we are able to access the following services: an advisory teacher for speech and language difficulties, an advisory teacher from autism, children and adolescent mental health service, educational psychologists, and advisory teachers for assistive technology. Nominated Governor. The nominated Governor for Special Educational Needs, together with the Director of Additional Needs and the Headmistress, monitors the most efficient use of the SEN budget. He and she report back to the governing body and parents on the effectiveness of this policy. Complaints procedure. If there is a complaint, parents and carers are asked to speak to the tutor, the Director of Additional Needs, or the Headmistress in the first instance. If the matter is not resolved, then parents should contact the SEN Governor or the Chair of Governors in writing. If following this action the matter remains unresolved, then subsequent recourse can be taken through the local education authority area office. And now we have finally some targets for future development. Target 1, we will review and modify support staff deployment. 2, we'll fully establish new systems of interventions in the light of new codes of practice. 3, we'll fully endorse the teaching assistant team with a view to developing staff into specialist members of the support staff team. So that ends this document. It was drawn up in September-November 2015, and the date for its review is September 2016. Thank you for listening.